Good morning, Queensland. So, I'm sorry we're a bit late today, but we had to have a couple of meetings and get some further information because I wanted to give as much information to the public as possible. So we have 8 new cases today, 3 are in overseas quarantine and 5 are locally acquired. I'll go through those in a moment. So we have 47 active cases. Yesterday we had 25,145 tests, which is fabulous. So thank you very much, Queensland, for doing the right thing there. And that's one of the keys to all of this, is making sure we have those really high test numbers. And yesterday we had 14,968 vaccines, so that's excellent. Now I just want to go through these locally acquired cases and then Dr. Young will go into a bit more detail. So the first one we don't have much concern about. So a known contact from the Portuguese restaurant cluster and detected in hotel quarantine, so that's good news. The second one was the one that was reported late yesterday, the man in his 50s who lives at Aruna and worked at the Sunshine Coast University. We are confident now that it is likely to be linked to the Portuguese restaurant outbreak, so that's the Alpha strain. So we don't have too many concerns there, and his close contacts there have been tested and come back negative. Now the next one, I really need the people on the Sunshine Coast, the Noosa area to listen to this. So we have a 29-year-old Brisbane man, and he has travelled to Yamundi, and he is related to the woman we talked about yesterday, and who's linked to that Carindale Greek Community Centre. Now, this man has been, early advice is he's been to Yamundi, Sunshine Beach, Kenilworth and Doonan. So if you are in any of those areas, we really need you, if you have any symptoms whatsoever, to get tested. We also understand that he and his partner also went to a restaurant at Sunshine Beach. So we are trying to get that information, so that will be updated through the media later on. So we have some slight concerns there about those areas, but I know that people around that area will be thinking very carefully about whether they live in those areas or work in those areas. And if you have any symptoms whatsoever, please come forward and get tested. Okay, so the next person is a woman in her 50s from Everton Park. Dr. Young will go into a bit more detail, but my understanding is she works at Prince Charles Hospital. She only worked 1 shift, not in a COVID ward, and had her first dose of vaccination. So Dr. Young will talk about that. And then we've also just had in that we have a man in his 50s, a baggage handler who works in Brisbane Domestic Airport, lives at Carindale, and is not a known contact. So in relation to these last three issues I mentioned, we are very closely monitoring those. We are doing a lot of work with the contacts, but we believe that our contact tracers can get on top of those issues very carefully. So now for our Brisbane and Moreton Bay regions, and can I thank everyone for doing that extra day that we asked people to do. That gave our contact tracers that extra time that was desperately needed. So the lockdown will end at 6 p.m. tonight, but we are not out of the woods yet. So I want to talk about a few things that I really need Queenslanders to do, especially in the southeast and of course Townsville. Now, we're all in this together, and we've got to have our trust in one another, and we've got to act as a community together. And there are 2 key things, or 3 key things that are really important. The first one is, if you're sick, get tested. And I really need people, if anyone is feeling sick, any symptoms whatsoever, please come forward and get tested. The second thing that's really important is to wear your mask. These masks are mandatory. Now, there could be some other community cases out there, so we really need people to wear their masks. So the masks, and secondly, your phone. If you're going out, you must check in. I'm asking businesses, please do not allow people into your businesses unless they have checked in. If it means putting a staff member in to make sure people have checked in, this is vital for our contact tracers, especially over this period until the 16th of July, when the mask mandate will end. Now, I'm also asking people in this area for another key response, and that is our vulnerable group, our people aged over 70. Look, over the next 13 days, please, if you are unvaccinated, please limit your going out. You know, close family is fine, but please limit and think about, you know, whether or not you need to go to a shopping centre, whether friends or family can drop some food over to you, because we do know there is virus out there. So we need everyone to pull together and act cooperatively and put our trust in one another and really think about the most vulnerable people in our community, because I think it's around over 70% have already been either vaccinated or have their first dose, but some of them haven't had their second dose. So look, it is just really important over these next days to really think about, if you're in the vulnerable category, do you need to go out and about in your community? And please limit that. So where you can stay home, please stay home, but if you're going out, make sure you wear your mask. So that's good news today for people in the Brisbane City Council and Moreton Bay. But as I said, we are seeing some cases popping up. We've had people in lockdown for a period of time, but now we really need to make sure, until the population, until we have people are vaccinated, we really need to make sure that people are doing the right thing with their masks and the check-in app. So I'll hand over to Dr. Young, but thank you, Queenslanders, for doing the right thing. I'm so proud of you, and please, over the next days, we'll be monitoring it very closely over the next 13 days, but please, I know we can do this together, and I know Queenslanders will wear their mask. I know that they'll do the right thing. Thank you.
Thank you, Premier. So, 8 new cases in Queensland overnight. 3 of those in hotel quarantine, overseas travellers. 1 had returned from Indonesia, 1 from Japan, and 1 from South Africa. Then 5 locally acquired cases. The first one was someone who tested positive day 12 after having contact with that Portuguese restaurant cluster, and they were in hotel quarantine, so they were there the entirety of their infectious period, so they are no risk. But remembering this is the Alpha variant, and we expect cases up to 14 days. That's the incubation period. Then the second case is the gentleman that was announced yesterday, who lives in Aruna in the Sunshine Coast, a man in his 50s who works at the Sunshine Coast University Hospital, and we got his genome sequencing result back late yesterday, and it's Alpha, and it clusters with the Portuguese restaurant cluster. So he's acquired it through some process of contact with someone who's been there or someone else who's got infected from there. His immediate close contacts at this stage have all tested negative, but remember there's 14 days incubation to go. Then the next case is a healthcare worker who works at the Prince Charles Hospital, who lives in Everton Park. This is a lady in her 50s. She does not work in the COVID ward, but we of course are confirming whether she's had a reason to go into that ward for any reason. She has received the first dose of the AstraZeneca vaccine and was due in the next few weeks to get the second dose. So, and she did work 1 shift while infectious at the Prince Charles Hospital, so we'll have to contact trace there, of course. Then our next case is a man in his 50s who works at the domestic airport. He lives in Carindale, not in the same household as our 2 cases in Carindale, a different household. So we're just urgently, of course, getting his genome sequencing result to work out where he's acquired that. So yesterday, I'm very, very grateful to the Brisbane Airport Corporation for their assistance. We tested 700 workers across the international airport and the domestic airport, and this was one of those people, so a routine test. And we're aiming to test every single worker across those 2 sites. Then the next case is a man in his 20s who travelled up to Yamundi on the 27th of June for a holiday. He usually lives in Brisbane, and he has a relative who's positive from the Greek centre, so that we announced yesterday. So we believe that's probably how he's acquired it, but again, we need to wait for genome sequencing results. Now, this is very preliminary information. We're still talking to him and interviewing him to find out where he's been, but initially the advice is he's been staying in Yamundi, he's been to Sunshine Beach and visited one of the restaurants there, he's been to Kenilworth and Doonan. So anyone in that part of the Sunshine Coast, any symptoms at all, immediately get tested, and anyone in that part of the Sunshine Coast who's been there since the 27th of June, please look on our website for any of the venues of concern that we'll be putting up this afternoon as soon as we've completed our interview with the gentleman. So we now have 47 active cases in Queensland, a total of 1,714 cases to date. And yesterday, thank you to those 25,000 people had tests done. That was a brilliant outcome. It's really important. Going forward, we have to get people tested. So if you've got household members who are unwell, tell them to go and get tested. If you're unwell, get tested. Any symptoms at all, that is really critical. And isolate until you get a negative test result. So get tested. Wear your mask. We didn't have masks, if you remember, last March when we were seeing cases every day. We know masks, although not 100%, of course, but they are pretty good at protecting people. So please wear your masks and use the QR codes. We didn't have them a year ago. They're critical because that means we can just get hold of people so much more quickly and get them into quarantine. So we know with the Delta variant that typically infects people very quickly. So we need those QR codes so we can catch people as soon as we possibly can and get them into quarantine. Thank you.
It's a huge relief to be able to lift the lockdown in the Brisbane City and Moreton Bay Regional Council areas. There are three things that will keep us out of lockdown: masks, QR codes and testing. And if we can keep those up for 13 days, we can avoid another lockdown. Hopefully this will be our last one. For the first time in a long time though, there could be cases in our community that we don't know about. And so it's important that everyone, particularly in the southeast, goes about as though they could come in contact with the virus. And that's why those three things are so critical. Wear your mask, sign in with the QR code sign in app, and get tested if you have any symptoms or concerns at all.
As you have heard this morning, and we're going to keep saying it, masks and social distancing is one of the key things we need people to do as we lift this lockdown across our local government authority areas that are continuing with other restrictions. Check-in app. The onus is on everybody, not just the individual to do their part to keep themselves and their loved ones safe, but also the businesses. We expect businesses to make sure you are not allowing people to sit down and dine until they have shown you that they have checked in. This is absolutely critical. We have seen it across the country. We need to be able to contact trace very quickly so we can contain the virus if there is anyone else out there. And of course, testing. Any symptoms whatsoever, go get tested. This is how we can keep our community operating, the economy open, and keep us all safe. Now, the roadmap will be updated today, but I remind everyone across the 12 local government authorities, as well as Palm Island, that we will have the higher level of restrictions, the 1 per 4 square metres with larger venues, the mandatory mask wearing, the limits on how many people can be in the household, and also at weddings and funerals. So we ask people to have a look at the roadmap that will be updated today. And also, anyone across those local government areas or who have travelled into those local government areas over the last few days, please keep checking the Queensland COVID website for exposure sites to see if you have been to any one of those sites, and follow the advice on our website in relation to contacting Queensland Health and also quarantining yourself and getting tested. If we do all these things, we can keep all of us safe, and we can also make sure our economy stays open. Thank you.
So as you've heard the importance of masks, can I just remind everyone that that part of what we're doing is not over. So for the next 13 days, everyone will have to wear their masks. To date, we've handed out 452 masks to members of the community. So the point there is that every one of those persons was not wearing a mask. Yes, they were compliant with us when we've given them a mask and asked them to wear it, but please don't go out without your mask, and make sure you do wear it, because we've had to give out 11 penalty infringement notices since we started, including 4 yesterday, which were all for masks. Now that infringement has now risen up to $206 for every person that fails to wear a mask and does not do so when we give them the opportunity to do that. So we're going to persist with that, but we really need people to comply with that. On the rest of our operation, we've seen some very good compliance. So yesterday, over 2,200 vehicles intercepted at our road borders and no turnaround. So everyone's doing the right thing coming through there. So thank you for that. We had 1,858 domestic arrivals, of which we turned around 8 and put 142 into hotel quarantine, and we had 200 international arrivals. So as of today, we have 2,858 people in hotel quarantine in Queensland. That number has gone down in the last 24 hours, so that puts us in a pretty good space, but nonetheless we are still seeing high levels of people coming into the state that need to go into hotel quarantine. Thank you to the community, in particular the South East Corner and Council, for their cooperation over the last few days with our officers on the road. That makes everyone's life easy, but as we have heard, it is not over. Please keep working hard to keep everyone safe. Thank you.
Steve, just while you're there, we
Sure.
heard about kids on the north side hooning overnight as well, just defying the lockdown rules. What's your reaction to that?
Look, one, they're putting themselves at risk by hooning. That is a really silly thing to do. There are serious penalties depending on what they're doing, and if they're driving dangerously, we get into the criminal space. We've seen some of the tragedies that have happened in this state this year with that type of behaviour, so that's not acceptable. But to do it in a period when we've got a lockdown, when we're trying to stop the spread of a virus, is really irresponsible. They can expect us not to take a particularly compassionate approach to that. We'll take very much an enforcement approach. Thank you.
Because we've had the last 4 days to really get hold of people and work it through. And because I think Queenslanders know what to do. They've been doing this now for 18 months, and we've got more things at our disposal. As I said, a year ago we didn't have masks because there weren't any in the world. We didn't have the QR check-in code. And we didn't know a lot. We were still working through it. We know all that now. So I'm comfortable that if people wear their masks, if they maintain their social distancing, remember we're not going back to where we were, we're going back to 1 per 4 square metre, everyone has to be seated, you can't dance, all of those things, we're going back to where we were after we'd done all those lockdowns earlier in the pandemic. So it's really about people being sensible, which I know people are, and being cautious, which I know people are. We just need to get more people vaccinated as we go forward. It's really good to see that 70% of our most vulnerable people over age 70 have had their first dose of vaccine, only 15% their second dose, but that's because most of them, of course, have had AstraZeneca, and you need to have that minimum 12-week gap. But people, as they're coming due for their second dose to get full protection, it's really important they get it. And you heard the Premier say, and of course I totally support that, that anyone who is in that vulnerable category who hasn't been fully vaccinated should consider whether or not they should leave their home, whether who they should interact with. So if we do all of those different things, I'm comfortable that we just continue then doing our contact tracing and working with people.
Because you had to crunch the numbers this morning. Was that fifth case? Do you have to link that to the Greek restaurant? What had to be done this morning with your email?
It was because we had 8 cases this morning and some of them came in quite late. So I had to go and get the information. That's why there's been the delay to have the press conference later in the morning.
Just
How
with
many
that Prince
cases or
Charles
clusters do
case,
you put it at the moment? So how many clusters do you put it at the moment? And how many people are in self-isolation? How many thousands?
We've got thousands in isolation
How many?
because we use thousands and it's going up every minute. And that's really important and that's the work that we're doing so quickly. And that's why we need the QR code, because we just don't have the time to have to go and find all these people. We need to just have direct details so we can contact them very quickly. And we're being very, very cautious. My view is I prefer to put more people into quarantine than ask the whole city of Brisbane to be in quarantine, in isolation. So thank you very much to those many thousands of people who are today at home in quarantine for up to 14 days. Now, some of them, and you've been hearing this the last few days, we've actually asked to go into hotel quarantine. We don't ask them to pay for that. When we ask, because we've made an assessment that it's too risky for someone to stay in their own home, and they go into hotel quarantine, we don't ask them to pay for that, and I'm grateful. So we've had a number the last few days that have become positive from that alpha variant while in hotel quarantine.
Dr. Young, we've spoken to someone at Bloke in hotel quarantine, like he'd been to one of the exposure sites and now he's in a hotel. He's been waiting since Wednesday, since his test, to get tested rather. Is that, like, should he be tested within 24 hours? He's still waiting to get tested.
I need to know the specifics. There are so many variables here about when we test, because sometimes if we know when an exposure's occurred, there's no point testing immediately because they won't be positive. So I just need to get the details before I could meaningfully comment on it. So if you give them through to, we'll happily look at them.
Dr. Young, a similar story. There's a number of families that have come up from Melbourne and they're stuck in hotel quarantine for 2 weeks. They visited low-level exposure sites, but some are fully vaccinated and have tested negative for COVID. Why are they still required to hotel quarantine?
There shouldn't be anyone in our hotels from Melbourne. So last night at 9 p.m, anyone who's in our hotels, because they'd come from Perth, was released. And we also released from 1 p.m. yesterday anyone from Northern Territory. Off the top of my head, I can't remember when we released the people from Melbourne. But when another state removes their lockdown requirement, then they've made that assessment, and so we then no longer require them to. Now, the other thing, without knowing the details, if you want to provide the details, very happy to look into them. There is a problem, and so it's a really good question. Thank you for asking it. People, when you come from another state that's in a hotspot, if that whole state isn't a hotspot and you've come from an area that's not a hotspot and then you transit through the airport of that state, it's critical that you do it in private transport, because if you go in a public transport, you're exposing yourself to people in the hotspot, so therefore you're captured. So I don't know if that's what's happened there. I'm happy for you to send it through, but please, anyone. I have once declared an airport as a hotspot because they had an outbreak in that airport within the actual people, but usually airports aren't hotspots, but you must travel so that you don't come into contact with the people who live in that hotspot.
It was just an exposure site where the Virgin flight attendant, that terminal down in Melbourne, so they've been through that into Queensland.
Yep, so that's one of the examples, yeah. So there have been cases when we've all, because I meet with all my colleagues from around the country, and we'll then agree that a particular terminal might be an exposure site and people have to go into quarantine and we declare a hotspot. So for instance, given that I've now got these 3 cases here in our airport, we'll be working through. I have a meeting at 12:30 with my colleagues as to whether there needs to be any hotspot declaration for our airport. So yes, we do all of that work. But I know there's been other cases where people have been caught up because they caught public transport.
On your numbers, today's cases, sorry, on your numbers, today's cases, the 8 how many discrete clusters does that make now?
Right, they're all joined. So we've not got new things popping up. So really and truly, we've either got the Portuguese restaurant cluster, which is Alpha, and so we've got quite a few linked to that. So yesterday, for instance, I managed to link 3 to that because I got genome sequencing results. And today's case up in Umundi is most likely linked to that because they've got a relative who's a case. So I'm sure there's that. Then we've got the airport outbreak, and we know that the gentleman worked across the international and the domestic, and now we've got someone at the domestic, but he also lives in Carindale. So I need genome sequencing to work out which of the clusters he's related to. Then if I can go back, I can tidy up a few clusters for people if that helps. So we had all of those minors. I'm very confident that's all totally under control. We don't need to worry ourselves about that particular cluster anymore. That was managed by the contact tracers, etc., and that was a joint effort around the country. So there's not a concern there. And then those Virgin flight crew, I'm pretty confident with those, where we're at. So yes, there's a lot of things, but they're at different stages. The most concerning are the Portuguese restaurant cluster, which seems to still be generating cases, which we do know happens with Alpha because it has that full 14-day incubation period. And then there's what's happening at the airport that I'm still unsure of.
Dr. Young, people will make a comparison that we've had more cases today than the cases which I would have the snap 3-day lockdown. Can you explain why that's the case? Is that a change in policy or is that...
No. It's me trying to look forward what the risk is going to be. So if we'd not locked down for those 3 days, I suspect we would have had a lot more cases.
And just on the mum and daughter, do we know what variant the mum and daughter from
Yeah,
Carindale?
they're linked to the Portuguese restaurant cluster, and we've got genome sequencing back on both of them, and they're 2 SNPs different from some other cases there. So they're directly linked to the Portuguese restaurant cluster. It's part of that outbreak. I don't think it will be treated the same as the flu because I think it has worse consequences. So we do need to treat it very, very seriously as we have been. But in terms of every year, we recommend strongly that people get vaccinated. We are recommending strongly already that people get vaccinated. Whether it will have to be every year, we'll have to wait and see.
And the hospital worker, did she have contact with patients or what are you doing?
Yes, 1 day. So she was at work for 1 day, so we'll now work through all that contact tracing.
Dr. Young, why is it we see one Delta case in Sydney sparking dozens of cases in a 2-week lockdown, but then here it's a quite different outcome?
It's a totally different situation. Our outbreak that I'm concerned about is an Alpha outbreak. We have had those 2 confirmed Delta cases at the airport, but they've had less interaction. It's all about whether you've got a super spreader. So we've had other Alpha-related outbreaks, and there's not been a super spreader, and we've got on top of it very quickly. This time we clearly have.
Premier,
After National Cabinet, so are you fully supportive of the full-phase plan for now?
Yes, we actually all agree to the plan, and of course we know that we need to get as many Australians, as many Queenslanders vaccinated, and I still maintain, and the federal government says it as well, it's dependent on the supply, and they are responsible for supply.
Will that be before Christmas?
Sorry?
Do you think that will be before Christmas?
Well, that's what we've been advised, so that's good news, and I think we'll see a whole lot of supply coming, and I've said this from my advice, that it's going to come in that last quarter, so from October through to December.
just on the cap on international arrivals,
Yes.
what's your reaction to that? Gladys Berejiklian clearly said that she's disappointed more Australians won't be allowed in.
Yeah, we have a bit of a different opinion on that. So my view, which is shared by I think the majority of the states and territories and I think the Commonwealth, is that you actually, if you reduce the caps, you reduce the risk. And that's exactly what we're trying to do here. like I said, our quarantine is stretched. It's a pressure cooker. We need to reduce some of that risk. Now, the federal government has also said that they will be doing some repatriation from vulnerable Australians overseas into Howard Springs. That is the perfect logical answer as well. So I think we just need to get on top of it. We need to lower the potential risk, and I think we'll see a good outcome as more and more Australians get vaccinated towards the end of the year. So it was a very good meeting.
In terms of Australians coming home, do you
Yes.
think vaccinated Australians and Queenslanders should be given preference?
I don't necessarily know if it's preference, but I still maintain that we should have a situation where Australians leaving should be fully vaccinated and people coming into Australia should be fully vaccinated. But that's a federal government issue. They are responsible for the circumstances in which people leave and the circumstances in which people come.
Would you be open to trialling home quarantine for return?
We said we were actually supporting that trial. I think South Australia is going to be looking at that in the interim to see how that works. I think the only, we need to get some further advice from AHPPC that you can still be vaccinated and you could still have the virus. So can you still spread that virus? That's the issues that AHPPC is working through at the moment.
What will the rules be at the game tomorrow?
Sorry?
The Broncos game tomorrow, Wallabies on Wednesday.
Yeah, so look, the advice that Dr. Young has given us, and we discussed that at our meeting as well, because we thought that might be a logical question that comes up, is that people can attend that game, and of course they have to take their mask, wear their mask, and they have to check in using the QR code.
I mean, businesses have to be much more limited than that. I mean, what's your message to them? Have a big game where they don't have the best on capacity, but small businesses can only have one.
Well, they're sitting outside. This is, you've got less exposure, and as we know, the virus is out there, so it's more prevalent indoors when you're indoors. So that's why we have to have that limited seating capacity in cafes and restaurants, etc.
Premier, at the height of the pandemic, we were having press conferences at 8 a.m. How is today any different?
Well, we had to get further information. I think Queenslanders want the most up-to-date information. I don't think you'd want me to come out here and say something that suddenly turned out to be incorrect later on in the day. So, we try to give Queenslanders the most up-to-date information, and usually most of our press conferences from memory on a weekend have been around 10, 11 o'clock. So today's just a little bit late. So I apologise to everybody who's at home, and I hope people are enjoying some quality time with their family.
Premier, just for you and also for
Yes.
the Chief Health Officer.
Yeah, the last one, yep.
New South Wales has flagged that we might have to live with some ongoing restrictions, now that we've got the Delta variant and there are sort of cases popping up. Do you think that might be the case? We might have to live with masks more permanently or some kind of restrictions?
Well, look, that's a matter for New South Wales. They'll deal with their issues. Look, we take the advice of Dr. Young. Dr. Young has given Queenslanders the very best advice. I think the Deputy Premier said, I think we're in, day 521 of the pandemic at the moment. It's not going away. It's not going away until every Australian gets that opportunity to have that vaccine. And then, of course, there's discussions about having booster vaccines every year as well. And at the end of the day, my job is to keep Queenslanders safe. That's what I get up every day. That's my mission. That's the mission of everyone that's standing here. And we have to do this together now. It's up to the community. And I put my trust in the community. They put their trust in me. My trust is that Queenslanders will do the right thing.
Dr. Young,
Thank
can I ask you about that?
Just the last question, yep, and then we'll...
Dr. Young, do you expect that we might have to have some kind of restrictions ongoing for life, permanently in the not too distant future?
It actually depends on what percentage of people get vaccinated. I mean, the vaccine is a great vaccine for the individual. It's very unlikely that you'll get particularly unwell, and very, very unlikely you'll die. But we are seeing it can still transmit. So it just depends. If everyone got vaccinated, then I'm sure we would be going back to where we were. But if people don't, then we'll have to look at what the options are.
At the moment, we've only got about 5% of the population in Australia vaccinated. So, given that, what do you expect? Should we be doing social distancing, mask wearing, all those kind of things into the not?
Well, we're doing it. I've just come out now. Wear your mask, socially distance, get tested if you're sick, use the QR code. So absolutely, we've got to do those three things, And just be cautious. It's an awful way to have to live, but that's what we've got to do so we can defeat it till everyone's had the chance to be vaccinated. And I'd like people to not only have the chance, but to take it up.
Thank you. There you go.
The Charles City goes.